Hello, my dear students. My name is Fedorova. I am Associate Professor of the Department of Epidemiology, and my lecture is dedicated to the nosocomial infections, epidemiological characteristics, basics of infection control. Plan of the lecture. First of all, we will discuss about infections associated with the provision of medical care, epidemiological aspects. And the second position, infection control system in healthcare organizations. The purpose of the lecture to form ideas about the current state of the problem of infections associated with the provision of medical care, to characterize the system and approaches of infection control in healthcare organizations. Definition of the notion of nosocomial infections. A hospital-acquired infection, also known as a nosocomial infection, is an infection that is acquired in hospital and other health care facility. Such an infection can be acquired in hospital, nursing home, outpatient clinic, and other clinical settings. Pay attention that infections associated with the provision of medical care are local or systemic infections, the clinical manifestations of which were absent at the time of the patient hospitalization and during the first 48 hours of hospital stay. Heterogeneity of hospital populations of people. We should understand that micropopulations of people with pronounced heterogeneity in susceptibility are being created, sick and healthy patients. Reduction of general resistance, directed reduction of resistance. It may be various pathological conditions, the effect of the antibacterial drugs, frequent change in the composition of patients, the environment into which the pathogen enters is evolutionary not ready to meet it. Hospital populations of the pathogens cause active agents. The widespread use of antibiotics, antiseptics, and disinfectants lead to the selection of resistant strains. As a result, hospital pathogens are not controlled by immunity. Hospital environment also influences the formation of virulent hospital strains. First of all, the high concentration of patients, the therapeutic and diagnostic process affects the transmission mechanisms, and as a result, activates the natural transmission mechanism, create artificial transmission mechanisms. Infection in the hospital. Every patient staying in the hospital for more than 48 hours is at risk of infection with the cause-active hospital agents. In other words, an infection is considered to be nosocomial if clinical manifestations appear after 48 hours or more after staying in the hospital, provided that there are no clinical manifestations with infections at the time of admission, and the probability of the incubation period is excluded. Etiology of infections associated with the medical care. Infections associated with the medical care are caused by more than 200 species of bacteria, viruses, fungi, protozoa, and other microorganisms. Approximately 90% of the nosocomial infections have bacterial etiology. Viruses, fungi, and protozoa, as well as active parasites, are much less common. Before the advent of antibiotics, the main hospital pathogens, cause-active hospital agents, were Streptococcus and anaerobic bacilli. After the beginning of the clinical use of antibiotics, previously non-pathogenic cause-active agents or conditionally pathogenic microorganisms becomes the cause-active agents of the main nosocomial infections. This slide shows the main cause-active agents of nosocomial infections. So let's discuss about hospital strains. What features are characteristic of hospital strains? What is their relevance and why is it so difficult to fight them? Strains most effectively adapted to the local characteristic of the hospital department. First of all, they have included valence. This is the main feature of the hospital strain. And the second position, they have acquired a specific adaptation to the medicinal preparations, used antibiotics, antiseptics, disinfectants, etc. This slide shows the activity of disinfectants against Salmonella typhimurium, chloramine, and hydrogen peroxide. Microbes and bacteriophages in hospital environment. Of course, in hospitals, along with the circulation of hospital strains of microorganisms, spontaneous circulation of the various types of bacteriophages was detected. This phenomenon can contribute to the formation of stable self-regulating three-membered parasitic ecosystems that have a certain importance in the formation of hospital strains. Another important feature of the hospital strains is the ability to form biofilms. All microorganisms have the ability to form biofilms, but the degree of severity of this property is different, of course. Biofilms can be formed by microorganisms of one species or several species. And these slides show what microorganisms can and have pronounced ability to form biofilms. The first main position that attracts attention, the microorganisms that make up the biofilm are very resistant to ultraviolet radiation, dehydration, antibiotics, factors of the immune protection, immune systems. And biofilms are formed in various human organism hospitals, on medical equipment, on instruments, rubber and plastic drainage systems, on other medical devices used in surgery, urology, hematology, etc. Biofilms performs a protective function, of course, by microorganism creates increased resistance of hospital strains in the environment and medicine, medical preparation. Let's discuss about source of nosocomial infection. Who can be the source of infection? First of all, patients, environmental objects, medical workers. Rarely the source of infection are hospital visitors and extremely rare animals and plants. Nevertheless, the main source of nosocomial infections are the patients themselves and the staff of the medical institution. Also, the source of nosocomial infection can be the relatives and relatives of patients who visit them or take care of them. In addition, it can be rodents, for example, as examples, animals as a source of infections. Patients are the most significant category of source of infection. Patients with the clinical manifestation. First of all, carriers of infection, patients colonized by opportunistic microorganisms. Patients as a source of infection pose a threat to other patients, of course, to medical staff and themselves, for example, endogenous infections. So, the next source of infection, the environment is a source of infection. Many free-living microorganisms and facultative parasites, so for example, Aspergillus legionella, are able to persist and multiply on or in the various objects of the hospital environment, and any wet objects, including drug solutions, can serve as a favorable environment for opportunistic microorganisms, providing their participation in the development of the epidemic process as a source of infection. And individual cross-active agents can multiply in solutions of some antiseptics and disinfectants and have very resistant properties. Medical personnel are the source of infections. The epidemic significance of medical personnel is importantly lower than the previously listed categories of source of infection. The importance of medical workers as a source of infection increases since there are people with infection disease, so the skin disease and soft tissues than medical personnel are more often involved a second time, and of course mothers admitted to child care as source of infection. In definition, the source of nosocomial infection, there are many concepts and widely used. Self-infection means infection the source of the cause-active agents of which is the patient himself, which is equivalent to the domestic term, and cross-infection refers to an infection in which the source of the pathogen was another person's, the patient's or the staff of medical center, and the certain degree of conditionally and analogy can be drawn the concept as cross-infection, and infection the environment. Infection the source of cause-active agent of which was the hospital environment. This group includes most intestinal infection, respiratory tract infections, and other groups. All natural mechanisms of cause-active agent transmission are present in the epidemic process of nosocomial infections. Hospitals are a favorable environment for the implementation of transmission ways. Let's discuss about mechanism and ways of transmission. First of all, aerosol mechanism, fecal-oral contact, and artificial mechanism of transmission. Let's discuss about the aerosol transmission mechanism. The implementation of the aerosol transmission mechanism is facilitated by the high density of patients in hospitals, the presence of convections, currents of air, and general ventilation system, the use of the air conditioners for the air for supply of wet air, and of course just four main factors. Fecal-oral transmission mechanism. Pathogens such as the Salmonella, Escherichia, rotavirus in hospital settings and spread by the fecal-oral transmission mechanism. The transfer factors are hospital environment items, and the implementation of fecal-oral transmission can be in different ways. It is, for example, contact with source of infection, direct contact. It may be contact through hands. It may be another factors of transmission, for example, food, water, and hospital items. Food products as a factor for transmission. In hospital settings, food products can play the role of the final transmission factor. Then cause-active agents such as Salmonella, Escherichia, rotavirus get on them from the hands of staff, medical staff, or from the air in the during prolonged feeding. In this case, there is no growth of the microbes on food products, one of transmission factors. A contact transmission mechanism. Under normal condition outside hospitals, of course, the contact transmission mechanism, the low activity on contact ways, but in the hospital settings, mechanism is often the lead, is the priority of ways of transmission, and transmission factors include hands of medical personnel, linen, patients' care teams, medical instruments, and medical equipment. So let's discuss about hands of medical personnel as the most important factor of transmission. Pay more attention to the hands, since the hands are the priority factor of the contact transmission mechanism. The most important is the present microflora obtained by the medical personnel as a result of contact with the infected patients or contaminated items, contaminated objects of environment. In many cases, the cause-active agents released from the patients are not found anywhere except in the hands of the medical staff, and microorganisms through the hands by the hands of medical staff can be transmitted to patients and contaminate medical and hospitals items, objects of the environment. And the last mechanism of transmission of nosocomial infections, the artificial mechanisms. The artificial mechanism of infection with the cause-active agents can be associated with diagnostic procedures, invasive and non-invasive procedures, medical procedures, and surgical interventions. Through the artificial mechanism of transmission, infection is possible, for example, hepatitis B, D, C, viruses, infection, HIV infection, staphylococci, streptococci, gram-negative microorganism, and other cause-active agents. The slide presents the factors of artificial transmission of infection disease in dentistry, and which are priority and primarily related to the organization of high-quality disinfection and sterilization. Look at these factors and remember them. If we look at the structure of nosocomial infection, we will see that pneumonia is 21%, infection of the surgical area 21%, gastrointestinal infections 17%, urinary tract infection 12%, and primary bloodstream infection 9%. Of course, we have risk of nosocomial infections, whereas greatly dependent on their profile of the medical facility and the departments of the high risk. The Department of Intensive Care, units burn departments, oncohematology departments, hemodialysis, traumatology, urological department, and other departments in which the intensity of performing invasive manipulations, procedures is high, and of course we have highly susceptible patients are hospitalized. The most important part of the lecture is the prevention and control of nosocomial infection, and we will discuss about infection control. What is it? Infection control is a system of organizational, preventive, and anti-epidemic measures aimed at preventing the occurrence and spread of infection associated with the provision of medical care and based on the results of epidemiological diagnostics. The main role in monitoring infection control is played by the duties of the committee. Administration representative, hospital epidemiologists, departments nurses, intensive care and operating nurses, representatives of therapy, surgery, gynecology, pediatrics, and the sterilization department, hospital engineer, microbiologist, and pharmacy manager. So let's discuss about prevention of nosocomial infection. First of all, minimizing the duration of the patient's stay in the hospital before surgery. Treatment of background diseases, hair removal, skin treatment in the surgical incision area with antiseptics, and the preventive administration of antibiotics. The techniques of operations, reducing the duration of operations, optimal use of drains, post-operative care, prevention of the cross-infection, and treatment of surgeons' hands, and environmental monitoring by the detection of microorganisms in the operating tanks, in the operating reservation, in their items. Next position of preventive measures, isolation and restrictive measures should be applied to the patient with the clinical manifestation form of nosocomial infection. Patients carrying epidemiologically dangerous strains such as Klebsiella pneumonia, Pseudomonas aeruginosa, antibiotic-resistant strains of any conditionally cause-active agents, and the patients who have at the risk of developing clinical manifestations forms of nosocomial infection with high susceptibility to pathogens. The introduction of the infection control system ensures early diagnosis of cases of infection with clinical manifestation and timely appointment of treatment, permanent knowledge of the epidemic situation in hospital departments by the epidemiological diagnostics, and prompt implementation of the anti-epidemic measures, and reducing the frequency of isolation of antibiotics resistance pathogens from patients, and of course reduced use of reserve antibiotics. So my lecture is over. Thanks for attention. Be healthy. Good luck.